Hello everyone, I am Dr. Gourab Bhaduri. I am a consultant gastroenterologist at Manipal Hospital, Broadway. So today, during this monsoon season, I want to highlight three very important aspects. One is how food poisoning can be prevented during the monsoon season. During the monsoon season, there is a frequent contamination of water, and also the climate itself cultivates the growth of different microorganisms like bacteria and viruses which are harmful for our body. This leads to contamination of the food items as well, and so there is an ever increasing burden of food poisoning presenting at gastroenteritis, particularly in this monsoon period. Most of the gastroenteritis patients present with pain abdomen, which is usually cramping type pain, accompanied by vomiting and loose stools. A most important aspect in management of these patients is adequate hydration. Most of these patients of acute gastroenteritis who suffer from because of underlying food poisoning usually recover from supportive treatment that comprises hydration. That is, hydration should be the cornerstone of management. Further, this food poisoning can be prevented by adopting healthy eating habits like consuming freshly prepared food, avoiding consumption of stale or stored foods, minimizing the consumption of foods with preservatives, and also to store foods separately, cooked foods separately from raw foods. Also, when we are unsure of the quality of water, it should be particularly boiled or filtered, and we should always consume water that is purified through aquaguard or mineral water. If we adopt these healthy lifestyle eating habits and also refrain eating from outside facilities as far as possible, then we can definitely prevent this food poisoning. And unfortunately, if anyone also gets afflicted with food poisoning, it can be easily managed with adequate hydration and other supportive managements. And once there are any warning signs like decreased urine output or confusion, particularly in case of elder geriatric patients, one should immediately resort to taking opinion from a physician. So to conclude, this food poisoning is definitely a concerning issue in the monsoon season, but it can be easily prevented by our protective measures, and also it can be easily combated through proper supportive and protocol based treatment.